Hi, everyone. I know most of you know me from healthcare, and that's correct. I've worked in healthcare since 2000 and much of it in value based care. But perhaps a lesser known fact is that I also was a teacher for many years prior and have been a college professor in the social and behavioral sciences since 2009. Today, in addition to running my own company, VBC1, and consulting in value based care, in my spare time, I do my own research, work with doctoral students as their dissertation chair, and occasionally teach graduate classes in research methods, and all because it's a passion of mine, truly a hobby. So, in addition to sharing with you operations best practices for value based care, I'd like to also share with you strategies that I think will be important for guiding behavior. Because as you know, you can't be successful in value based care unless we get our key stakeholders to participate. I'm hoping in this episode to impart to you best practices for engaging those stakeholders, strategies that I've used over the years that helped me get the results that I did when working with clinicians and patients. We are always learning. When you health plan, share your value based programs or analytics with medical groups, or vendor, demo a new product, or medical group, call patients on the phone to schedule their mammogram, you are attempting to shape behavior. And I would go so far as to say you are educating because you are strategically sharing information in a way that you hope to get a desired result. One of the things I've noticed in the industry is many of us introduce programs, share analytics and reports in a way in which we were taught. We speak and expect the receiver to whom we are speaking to listen and absorb said information and perform that desired behavior so we get a particular result. And for most of us, when we are in those situations, the experience we're drawing upon comes from when we were school-age children. We tend to teach in a way in which we were taught. But there's a key distinction in how one would communicate information designed to shape the behavior of a child versus an adult. When we interact with children, we call that pedagogy. The strategies and the approach are totally different than what one would use when working with adults. With adult learners, we use an approach called Andragogy. Adult learners don't need to be directed what to learn. Help them identify a problem that is meaningful to them. I once worked with a physician group where we reviewed their charts to find opportunities first, rather than looking at reports. Analytics couldn't tell the whole story as they were missing the narrative. The group got engaged when we showed them that we were wholly invested. Adult learners have so much experience, it's better to gain their engagement by appealing to what they already know. It is easier to add to a mental model than to build something new. As example, you might ask a patient how their health has been, or a client what has worked for them and what hasn't about the current strategies that they're using. Adult learners don't follow a sequence, but rather learn until satisfied. Be ready with materials and supports to help the adult learner get there. You might provide a clinician with in-person hands-on training and clinical trials to entice them to use a new screening device. You might suggest a patient and their family read books, watch videos, and attend community cooking classes together to help them best manage their diabetes. Adult learners need to understand why they need to learn something, and it's often connected with a need to change. As a side note, and also a future episode, it isn't enough to answer them with because your contract says so or entice them with money. You truly want to get at what motivates them. Adult learners often seek to learn for their own personal development versus the acknowledgement or accolades from others. So, how does one engage and inspire adults? Make it relevant. Encourage adult learners to explore. Consider the experience and educational background of those adult learners, and offer immediate feedback to allow adult learners to learn from their mistakes. And some additional notes: know that adults learn best when they want or need to learn something. Help them discover what that is. In a non threatening environment, don't call them on the carpet. Be sure to protect egos. When their individual learning style needs are met, some of us are auditory learners, visual learners, tactile learners. Think about that as you're engaging them in communication and conversation. When their previous experience is valued and utilized, and when there are opportunities for them to have control over the learning process, understand where the people that you're working with and communicating with are starting from. when there is active cognitive and psychomotor participation in the process. The more you can involve all the senses, the better. When sufficient time is provided for assimilation of new information, not too much too soon, make sure that you give information in a way that learners can pace themselves. When there's an opportunity to practice and apply what they've learned, remember, practice makes perfect. When there's a focus on relevant problems and practical applications of concepts, only focus on those things that you need to. Don't waste a physician's time or a client's time with noise. Really zero in on what's important to them and present only that information. That'll open the door for future conversations. When there is feedback to assess progress towards their goals, feedback is so important, and it's really important that it's received at regular intervals and that it be timely. Otherwise, you run the risk of promoting unwanted behaviors. It's important to interrupt erroneous mental models early and often, so you might redirect behavior and encourage the behaviors that you want to continue. I've given you a lot of information to think about, and you might be thinking, well, how do I apply this to what I'm doing? Or does this even apply to me? Or doesn't my marketing team already have a handle on this? It can be challenging to unravel the intricacies of healthcare engagement, operations, and strategy. Never fear, because VBC One is your go-to partner for navigating the complex landscape of healthcare operations and value-based care. We understand that applying strategic insights requires a tailored approach, and that's where we come in. We specialize in designing masterful patient engagement strategies and scripts, whether you need assistance crafting a compelling message or training your team to deliver that script with impact. VBC One has you covered. But it doesn't stop there. If you're a provider enablement company seeking that extra edge, we offer a unique perspective. Picture this, having someone with real, honest-to-goodness operations experience to review your pitch deck or sit in on your sales calls, ensuring that your message lands just right with all the stakeholders at the table. Now you might be asking yourself, how do I motivate a CFO versus a CMO? Well, we've got the insights to tailor your approach for maximum engagement. Each stakeholder requires a unique strategy, and at VBC One, we know the nuances that make the difference. And for those working closely with clinicians, we understand the importance of documentation to the highest level of specificity. Our expertise ensures that you can collaborate effectively, capturing necessary information for optimal results. Interested in how we can help you? Schedule a call with us today at bbc1.com.